Full. Thank you. Make sure. Perfect. So that is our introduction again, and welcome everyone. We're so glad you're here, and everybody that's new, we're excited to get to know you, have you get to know us. And this really, really important work. So let's dive right in. We do take some time for public comment. If we have anybody in the room or online that would like to make public comment, now is the time.
Nope, there's been no, wait a second, no messages, no flags.
Not
I'm just, yeah, I'm here as public. Yeah.
great. Glad you're here. No public comment, so we're gonna keep plugging along, guys. So we're gonna dive right into our third agenda item, the fiscal year 25-26, program year 5 planning. I'm gonna pass it back to staff.
Right. Thanks, Kim. I'm going to walk us through our presentation today, and Jess and I are on hand to answer any questions. As the Solutions Council may recall, we've actually maybe we'll go through to the next slide. Before diving right into our past work, want to just remind us of our guiding principles in this work and how we're making programmatic reductions. This is a conversation we've been having with you all for nearly 5 months. So these are familiar guiding principles, but just want to put these on the screen, make sure we center our values as we have this conversation.
Are we supposed to be able to see the slides?
Yes.
Okay, we can't.
Oh.
I'm able to see them. You might want to go up to the top right where it says view
Oh.
and make sure that,
Full screen maybe?
see.
All right,
yeah, there's-
I don't mean to, I have no idea what's going on, but well, I'll figure it out.
Well, maybe Chelsea, would you mind on the side just sending Rachel the slides in her inbox? So it's top right there, and
Yes.
but others can see them.
I'm gonna log off and log on again and see if that helps.
Okay, we'll see you soon.
All right.
All right, well, we'll keep going, and just as a reminder to folks, we've been having this conversation for quite some time. Next slide, please. We've started this conversation back really in the summer when we realized revenue for the supportive housing services wasn't at the level we expected it to be at for last fiscal year. We had about a $6 million delta between forecast and actuals received that year. And then the updated revenue came back in December. So we had a number of conversations about the revenue constraints. And at last month's meeting, we reviewed the draft budget, heard conversations, and heard a lot of, we hope you see that feedback in those conversations reflected in the considerations and how we'll turn programmatic reductions into contract commitments. That conversation was really helpful to us as we've engaged. I do want to clarify, we've submitted the budget as was presented to you all to the county administrative office. That presentation was this week, along with the rest of the department investments and budgets. And now the staff are doing the hard work of turning those program reductions into contract commitments. Just again, one more reminder slide. On the next slide, we have the high level budget, we're high level budget categories. So in each of these categories in the memo, I included the table from last month that showed what reductions were made in each of those categories. We're going to begin a conversation on the considerations and factors staff should keep in mind as we plan for next fiscal year. So the next slide, I want to introduce you to our decision-making process and the way we're thinking about this. You'll note there's a key decision that has to be made, and we're considering there's factors that will influence each of those decisions. And each factor has its own consideration for how to use that factor. So this is kind of the process in which, or the structure in which we're thinking through weighing what are some hard realities. As we go through these, keep in mind if there's additional considerations a factor needs, or if there's any missing factors or any considerations or factors that don't align with feedback or your thoughts on how we should move forward. I'm gonna go fairly quickly just to make sure there's room for the discussion questions, and we'll dive right into data-driven performance metrics. We know we want our system to be data-driven, we want to be solutions-oriented, and we have a lot of data to work with. So the department provides monthly scorecards to our providers on set metrics that are determined by program. So that this includes for our our housing case management services program, enhanced rapid rehousing. Each of our programs have specific metrics that we're tracking month over month, provider by provider. So we'd like to use that as a factor in our decision making, but we know that there are considerations to those factors to include what's been uplifted from our providers is that the data accuracy of scorecards could be improved. There might be inaccurate or outdated information on those scorecards because of the way we're pulling data from the homeless management information system. Another key, to me, a very key consideration, a lot of these are brand spanking new programs. We launched them in the last couple years. We all know public policy and programming takes some time to get things right. There's iterations and tweaks along the way. And a lot of the performance of these programs are influenced by county policies and by the way we have set up the program and not the work of the provider. So just something for us to consider as we consider outcomes and metrics, that we want to be aware of both the accuracy of the data we're looking at and how long the providers have had to tweak this information. So that is factor 1 of 4. The next factor we have is around addressing racial disparities. We know there's action at the federal level to walk away from commitments to address racial disparities in housing outcomes. I want to say loud and clear that is not a trend we're going to follow here in Washington County. We know that government played an exacerbated role in creating racial disparities in housing outcomes, and we know it's our responsibility to address those. So that's a key factor and also a guiding principle of ours. As we look at this factor, there's some considerations, the first of which being population need, ensuring program reductions don't increase need or disproportionately increase need. We also know that our culturally specific providers are best attuned to serve their communities and see better outcomes in who they serve. And then the last piece of this being we have a lack of data on needs based on race and ethnicity, particularly for data that is disaggregated. We don't have that insight to all of our counties here, or all of our populations here in Washington County. All right, and I'll go ahead and move forward to factor 3. We're looking now at geographical reach. This is something that our cities have often brought up. We are a large county here in Washington County. We have a lot of city partners, and we need to ensure that resources are available across the county. Someone in Tigard should be able to access resources the same as someone in Hillsborough or in Beaverton or in Forest Grove. So certainly that's a consideration for us, or that's a factor for us. And then the consideration there is economies of scale. It can be incredibly expensive to have duplicate resources kind of in little pockets. So we have to balance geographical reach with the economies of scale and what it means for smaller operations. And the last factor we have is around balancing our needs with our program and system with the needs of our community, and understanding that different approaches or interventions are going to be necessary for different populations, and that even within populations, different approaches or strategies might work better for person to person. So there's certainly a factor in how we're starting to think through these tough decisions. And of course, a theme here, incomplete data, is we don't have perfect access to these data. We have factors and proxies we've used. We've presented coordinated entry data to this group before. So those are some of some pieces, but we know that it's not the full story of the need in community. We also know that economic forces are beyond our control, and homelessness, despite the intervention of the supportive housing service measure, continues to increase across the state and particularly across our region. That is likely to continue given some of the action at the federal level. So that inflow into homelessness is a challenge to consider and solve for. And then lastly, certainly not least, is also a guiding principle of ours. We, with the supportive housing services funds, are required to, over the life of the program, dedicate 75% of resources to population A and 25% to population B. Now that split doesn't necessarily align with the needs we see here in our community, but that's the charge of this funding source. So we have to remain fidelity to the split over the life of the program and understand that that may impact or influence how we meet needs across our system. So we'll pause here before we dive into discussions, questions. I want to ask, are there any clarifying questions?
Can I also just make a point of note, because there's so many people and because we have folks online, it's been requested that before you speak, if you could just identify who you are so we know who's speaking, sorry.
Thank you. Nicole Sting for folks online.
Stacy Triplett, I just have a quick question. I think the factors look great, like this is a nice umbrella, it makes sense to me. I'm wondering about the geographic reach one, and if there's a consideration that's around kind of, you know, land use patterns or housing production past or something around different communities and their commitments. If that changes how they will participate in the system. So that's it. It just made me think like, oh, well, is it a true statement that every community should have the exact same amount of
Yeah.
access to amount of resource? Because it's kind of like, well, some communities have probably done a better job at, you know, producing affordable housing that folks can use. So I don't know, just came to mind.
So a great comment, and I might add to that, something we haven't talked a lot about in this space, but is true of our funding source. SHS can only serve within the urban growth boundary, so there is some limitations of the funding source for geographical reach, just that it must be within the metro region. So appreciate that, and I'm curious, Justin, do you have any reactions in terms of the ways cities or jurisdictions have leaned into homeless services and how we might consider that as a factor or add that as a consideration in the geographical reach factor?
Only that as we in Washington County are having budget constraints, so too, and in many cases more so are our city partners. So it's rather than us being able to think, gosh, could our cities lean in to do these services? We're finding the opposite lean of the request coming our way, saying we can no longer
We can't do it.
manage this, what, you know, so I think that's more of the focus of how do we make sure we're supporting our cities to stay present in the conversation as they face such significant reductions.
Any other clarifying questions? All right. Well, seeing none, we can dive right in. You know, looking through the factors and considerations, is there anything that's not listed that should be? Any misses?
Okay, Jim Bain, I'm a panel member, I'm a community member. One of the things that I think I've talked about before and you're starting to address now is the demand part. I mean, we're very good at being presented the supply and what we have and what we can do, but we're not getting the data about what our demand is. And I think you're starting to clarify that. One of the things that I think would be helpful to me is, in addition to looking at who's coming into the system through your Community Connect, I'd also be interested for us as a panel to be able to look at the wait lists. Okay, so what are the demands and are we meeting them, and what are we not able to meet? I think that would be helpful in looking at how we allocate resources.
Something that I was thinking about, Drew Williamson, something that I was thinking about that I think ties into what you're saying is also making considerations or a factor, I don't know which one it would be, but for like which specific programs work best for specific populations. You utilize that wait list to maybe think about that.
Is there an extra slide deck that I can? There is a paper copy in the back.
I can.
We'll print it, we'll see.
Appreciate it.
Did you send the slide or no?
Nadia sent them out
Did you? Okay.
Thursday, Nadia, maybe
Friday.
Friday. So late last week, Zoe, bunch of attachments to
We
it.
can resend them.
Chelsea, do you have it? Did you just send it to? I sent it to Rachel, I sent it to her.
Something that may fit into systems balance is making consideration for the workforce that is doing the work too, and just ensuring that we're not creating a system that is over, that isn't feasible for them to, while we're making, budget restraints and potentially cutting spots or cutting FTE, we're not creating a system that it doesn't seem manageable for the workforce that's gonna be providing the work.
Drew, can you say more about what you mean there? Like, how would that apply to, I'm gonna give you a super random example, just to help illustrate it. How would that apply to, maybe I'll give you a real example, we've cut 65 motel voucher shelter beds. How would that factor consideration apply to that decision? Like, what would be some of the things we weigh?
Cutting shelter beds,
I guess I would go to, I don't know that this is a fact, just timing and figuring out, like as we're shifting and if we're gonna reduce here, but we're increasing here, is there an opportunity for that workforce, in this case, is what you're talking about, to make it be part of that shift? And that could be collaboration between partner agencies, like, hey, I'm gonna be losing the X amount of staff, but you're gonna need X amount of staff.
Yeah.
How do we do, some shifts in that arena? Think about workforce.
yeah. And I think one of the things I was thinking about too is making sure we're not asking as much as possible folks to do more with less, right?
And then I think another factor, and you spoke about, this is all new, and we did do it these last few months. You guys have been leaning into this, is what's working and what isn't, and continuing to have those conversations on how we shift more to what is working, and then maybe have question marks around what isn't.
What I think, Jim Bain again, I think the wait list.
Exactly, yeah.
And taking the wait list and looking at where, if you go to your high school chemistry class, what is the rate limiting step? What is the problem with that wait list going on to something else?
I did not go to that class.
Jim, I think I might have also skipped that class.
Yeah. If there was one I missed, that would be the one.
Will you describe that? The rate limiting steps to move someone from the wait list into housing?
Exactly. So if you have 100 people and you have so many spots, those people are going through, and where do they get hung up? They get hung up in entry? Do they get hung up because there's not enough places for them to go, which is what I think the answer is, but I think it would be helpful to be able to look and see where is that blockade?
And Jim, that is great. I'll maybe name what we often call that in the homeless services system is system throughput. How are we helping folks move through our system?
Can I jump in? I'm not,
So,
yeah, so I feel like part of this conversation is, what is it like from the perspective of the person using the services? And how are we integrating that into the considerations? I feel like that's a little bit of a different way of saying, actually, I'm not sure who it was who just had said that about the wait list and the chemistry class, but I feel like that's a little bit of a different way of saying that.
And Rich, I hear that as a new factor, and I just want to uplift and see if there's a alignment in the room there, with the factor being kind of centering the client experience, or what is the client experience? And I can think about different wording so it makes sense to our staff, but I'm seeing nodding in the room.
I've been, sorry, this is Zoe Copiano, Community Action. I've been thinking for years about that. Oh, I don't know if you guys hear this thunder. Participants have to be in touch with the system in order to maintain being in the system, right? But then the other way, it's we reach to the participants to see where they're at the moment, and then if they need to be on that wait list, but that it's capacity as well. So there are two ways. We reach out to the participants waiting for a spot or a program, and right now the participant has to reach to the system in order to maintain the spot. And sometimes, I guess, you forget you have to call. And some people solve their situations and don't need to call back to Community Connect. We can divert also, call back and ask and apply diversion techniques and remove them from that phase 1 assessment. I mean, there's so many interventions that we can do with people that are, like you said, waiting in that part of the system.
So Zoe, I hear that as a kind of consideration for how we balance system need, that we require participant engagement, so that might influence our understanding of need. Like,
Right. Right.
I'm attempting to leave enough awkward silence for folks to jump in, but then it got too awkward. All right, I'm not seeing anyone else engaging on this question. We'll ask the next one. As we talk about kind of within factors, there's considerations that conflict, but also when looking at factors next to each other, there's kind of some conflict or not full alignment. How should staff balance considerations and factors in decision making? Are there kind of certain weights we should consider? What are your thoughts on our approach in that balance? It's not usually such a quiet
know.
room.
Tired. February
Hope it's not me.
25.
Do you have anything in place now? So that you presented four considerations. What am I getting the wording right? I mean, at this point, is it just equally divided if we gave it percentages, or where are you looking for? Because I think we just gave you some more factors.
Yeah, there's some more factors.
So.
I don't know, and Jess, I'm curious for your response on this. I don't know that we have kind of everyone is thinking the same. This should be 2%. I think we're all weighting them differently in our own minds and bringing that into staff conversation. So the direction we're seeking now is there a specific way we should be thinking about that? Because perhaps the inconsistent way staff are weighing them and balancing them might bring more to the conversation, or if there's advice or guidance about factoring when I'm seeing some confused faces. So maybe I'm not saying.
Adam Peterson from Health Share. This will be my first official comment ever as a committee member. But, I think one of the things that like we've used in other kind of group decision-making process is trying to lead with equity and putting decisions through what's called the RELT, the tool, and trying to use that to guide any decision-making. And I've seen it be an effective tool or an effective framework to utilize in how decisions can get made when there isn't a right answer there.
Well, and I might I might name, I think some of the folks in this group have met Trinard May. He's our equity coordinator, has been with the department for about 6 months. And you'll see in the next question, he's standing up a culturally specific cohort of our providers that are culturally specific, and also working on implementation of RELT, our own RELT tool. That's in alignment with Clackamas and Multnomah counties delivering SHS services. So across the region, we're all using the same RELT for SHS.
Trinard's also in the call.
Oh, great. Hi, Trinard. Maybe we'll come back to this question. This is one that requires quite a bit of pondering, and I'll pivot to question, the third question here. We are planning on bringing kind of a version of this conversation to our homeless services executive roundtable, that is executive leadership of our contracted service providers. So helping them inform and weigh in on this conversation. We also, it says soon to be formed. It is officially formed. We have a meeting set, I believe it's March 6th, is our first convening of the culturally specific organization cohort. And we'll be bringing them this material to ask for feedback as well. We've also brought this forward to our city liaisons. As you may recall, we fund 3 positions that support engagement with 6 cities. And we've had this conversation, not quite as formally, but informally with that group. We're wondering if there's other stakeholders. We have a short time frame to make decisions. We want to get decisions to providers by April 1st or in April. But are there other stakeholders or organizations we should prioritize conversations with?
Are other subcommittees having these conversations?
It's not planned. We certainly could.
I'd look to you, Dina. I think there's an interest. I think there could be. And I don't know if lived experiences will be meeting in time. Yeah, probably not.
We certainly could circulate questions via email.
Yeah.
I'm particularly curious for those that kind of work in systems that are adjacent to the homeless services system. Are there other kind of non-traditional stakeholders we're missing?
I'm thinking direct service staff, direct case managers who are doing the home visits, shelter staff, Community Connect, answering the phone, like key people from all the different stages in the system. I think they should also have a voice. And we can have the voice of them because we're hearing, but firsthand, I feel will be a little more effective.
Thank you, Zoe. If I could ask both you and Drew, since he agreed with your comments, a follow-up question. Something we've also heard from our executive directors is maybe caution or a request on how the information about reductions are being shared with staff, because it's leading to anxiety and communications management at the organizational level. So I'm curious, totally appreciate your feedback and the importance of that direct service provider perspective, but the nuance of sort of also managing how that might feel when about folks worrying about reductions in their programs and leadership trying to manage those conversations internally with the organizations.
I feel like everybody's gonna address that individually. I mean, we've been pretty transparent with our staff about and what our restraints are, and so and our staff, I feel like are pretty engaged in these conversations anyways, so I think they would welcome the opportunity to participate in that level. But I can't speak to my staff.
Wait for that. Abel put in chat, school districts in the county.
Abel, can you remind me when the next McKinney-Vento liaison meeting is? I wonder if there's a way for us to take advantage of that existing space.
We actually just had our general meeting with just the liaisons earlier today. We have our next community partners meeting on April 17th, and that's from 9 a.m. to 11. And that's over at Home Plate in Beaverton. They're gracious enough to offer us that spot. But I was thinking when I wrote that down, not just the McKinney-Vento liaisons, which he, him pronouns, McKinney-Vento liaison for Hillsborough School District and part of the McKinney-Vento Education Network in the county. But I was thinking more about I hear stories from individual schools where families are going in requesting the schools directly for housing resources or rental assistance, that kind of direct support that you know, as an educational institution, they're not able to provide. And so if you're talking about stakeholders, I think, you know, the institutions that are educating our kids and supporting our families would be one that I would reach out to.
Thank you.
Maybe along those lines, Rigo Lopez, Sheriff's Departments.
Appreciate it, but this is a public meeting, so just members speak. I'm so sorry to do that.
What would you, I can't. tell
The public comment period is at the beginning of the meeting. Sorry to
Boom.
miss that intro there.
Was that my only time to talk? Is that what I'm hearing?
I'll grab you after this too.
Yeah.
And SHS staff are always open to emails or phone calls, and you can reach out to them after. Sorry about that.
No worries.
Good to have you here. We'll just have to make sure we get your comment.
Sounds good. Appreciate y'all. Okay.
Nicole, can we, because I just wanna, I wanna make sure we address Jess's concern, because that was a concern at the executive director level. It was kind of specific. But this is pretty broad, right? Am I getting, like, we're asking for factors and considerations as you're making decisions. We're not saying specifically when, you know, when we have to reduce outreach, how do you want us, like, so I think there's a way to enlist staff, direct service staff, to Zoe's point, and keep it at
It
the
wasn't an
level.
email letting us know.
Yeah. So I think that this is a great opportunity to have staff be like, hey, your voice is wanted. So if that's a survey or something, just to give them a little buy-in into it without it getting into the weeds of specifically this. Diana, did you have a comment? Please.
Yes, I believe there was already some mention about this, but since we do work closely with law enforcement, I think it would be a great idea to have someone representing that side, because we do tend to get a lot of referrals over at the Family Justice Center about houseless folks who are experiencing domestic violence or just any type of other violence and abuse who end up becoming homeless because of that violence and abuse. So I think it would be great to also have their voice. Currently, we work with some folks from BPD, Beaverton Police Department, Hillsborough Police Department, as well as the Sheriff's Office in Washington County. So there's a few folks that would benefit to hear their voice, I guess.
I think I'm having a moment. Was someone gonna say something online? Okay. Because it feels like we're getting a little, now we've taken it to a whole other piece when I don't know if there's certain arenas that could actually speak into it in a valuable way. Because they're gonna be like, well, I actually don't know what's working or not or happening or how this could like. And so for me, I've just shifted into a different space. I'm sorry, I apologize.
Chair, you are maybe in my mind, because my concern is not with getting it framed up, but more so we want to make a decision by April. We don't want to delay this decision because it's very important providers have the time to plan for any reductions and are aware of reductions. So I think the way I'm hearing this feedback or this information is maybe prioritizing some one-on-one conversations with folks that are proxies to systems and get some informal feedback that way. The HISN meeting in March might be a good opportunity to present this information. So I can try to work that in, and that has a lot of the direct service staff that are doing the work on the line. So I do feel like we can get that voice there. Abel, I'd love to maybe connect with you and think through how to bring in the school district voice. And we have a great relationship with the Washington County Sheriff's Office. We'd be happy to connect with them and Deputy, Schreiber, maybe
Schreiber.
Schreiber, yes, and help get his feedback as our Hope deputy. So I'm taking this feedback generally as ideas for some one-on-one conversations. We won't have the time to convene a lot of spaces to put together and analyze surveys. And I'll make also just a quick plug. We haven't talked about it yet in this space. Probably in the summer we'll start the conversation. And it depends what happens with the Metro measure, but we do want to do a local implementation plan update. And I will keep this list of folks you've mentioned handy and some of the spaces handy. So when we go up to do that, those are first on our list of engagement.
The question in chat from Rachel, curious about possible federal cuts become a factor in what SHS funding is used for.
Rachel, great question. I'm gonna place that question at the staff updates. We're gonna talk a little bit about federal updates there. For our current decision-making, we are not planning for reductions at COC for this fiscal year in the budget that's in front of us, though we are doing scenario planning behind the scenes, and should those scenarios come to light, we'll bring you all back in. Right, well, I want to take a moment and pivot back to that second question. And if the answer is allow the conflict to exist in your head in the way it exists for different staff people, that's a great answer too. Because each of these factors are important factors, and they can play differently with different decisions, and different folks with different backgrounds might see them differently. So, but I do want to ask if there's conflicting recommendations and factors or conflicting decisions that would be taken if we take one factor alone and then another factor alone. Are there any weighting or consideration for how they blend? And I'll maybe name one that comes particularly to mind for me is thinking about I'm trying to go to the exact slide, thinking about population need and system balance and geographical reach. We might have more need in one community than another. And should that influence us, or should we focus, on ensuring everyone in every part of the county has access to resources? So that's just one example of the way they might conflict. And certainly there's other thoughts about where conflict might happen as we think about particular decisions and particular programs. Yes, Rachel.
I think sometimes when there are multiple factors to making a decision, the factors end up being weighted so that ahead of time, there's some decision that's made about which factor is more important than the other factor, and weighting the factors. So this is worth 20 points. This is worth 30 points. And so that's like a little bit getting ahead of it. And I don't know that it fully addresses what you're asking, but I do think it's one methodology that's used.
So Rachel, that's exactly what's being asked here. So I think the question though, and I would love your input here, is the factors that have been presented to us and the ones that have been maybe even spoken into today, how would you rate those? What would your rating system be as a Solutions Council member?
Well, it's less about rating and more about the weight, the heft, the weight of them a little bit.
How would you weight them?
Yeah, I think is a better, because I don't know that you could rate them fully.
So how would you weight?
And I don't really know the answer, because I think I think it's a little bit where I think even when things are weighted, folks have a sense of where, folks frequently have a sense of where they want things to land or what seems to make most sense. And we kind of get there in more than one way when we're looking at these kinds of decisions, because we're also trying to, at the same time, there's this like nebulous concept of fairness that we're also trying to get to. I think it's as much of an art as it is a science of we assign different weights to different factors.
Right. So I would go to two different places right now. We could get comfortable that staff are already having conflict and they're coming in with their own energy and biases, and that brings the voices to the room that we want there. Or we could ask staff to pull together all the factors that we've talked about today, and we could do a quick turnaround email or something, poll or something, and we could give them weight of some sort. I lean towards, if I'm already hearing staff are already having conflict, that probably means our voices are in the room in some way, shape or form. But open to other suggestions. We need to give staff some direction here, and there is a quick turnaround on this, but the question is really specific is, hey guys, how do you want us as staff at SHS, not me, to take this? This just wouldn't hire me. Take this and move forward. And so I wanna leave them with some direction, even if it's like poll us, tomorrow with the factors that are being considered, or we just give them the authority to say, yeah, keep going with what you're doing. There's enough conflict, energy considerations in the room.
Well, I appreciate you're trying to help drive us towards clarity. But I also want to lift up that the feedback you've brought to the room is clarifying. Leading with racial equity, weighting that question the most is itself a very clear piece of feedback, and then adding in these other factors. And please know that each of the decisions are different and going to have different factors held differently. Because, for example, in the outreach program, we're looking at 3 positions we'll need to reduce, I believe it is. And outreach is so geographically navigated that that's going to naturally be a different kind of consideration than, for example, I think it's 7 positions in rapid rehousing or something like that. So I don't think the staff here are asking for absolute specificity or a scoring matrix, because we wouldn't even be able to apply that in the nature of the decisions we need to make. And much of what you've given us has really helped clarify the decisions we do need to make. Great.
I just think that, there's the bigger piece in all of this is data. All of this is like very paper driven, right? And at the end of the day, we are dealing with human beings. So I think the human aspect with the lived experience and like what people are really dealing with on a day-to-day basis has to be the driving factor for all of it, period. They're human beings. That has to be like forefront. So how do we affect whatever this decision we're making, the factors going to affect their humans. So treat them with respect and get them to the next place or assist them. I'm just saying, that's my driving factor. We're human, trying to help another human. So that's my guide, but that's, utopia. I live in that world. But I'm at the children's table, so.
In a good word. Children speak the truth. So I think that there's, in some of the decisions we made in the last meetings, I think I see a conflict between what we're doing and kind of what we want. So what I'm talking about is our contractual obligation to the population A-B split, which is another topic. But when I look at the money, the large money is in permanent supportive housing, right? And that we as a decision group, I think we have made that we would like to put some of our efforts into transitional housing. When I look at those 2 groups, that is permanent supportive housing is population A. But when we look at the new transitional housing, that's going to be a lot population A, and that is going to split. And when I actually do look at the data that you put out about the racial equity data, when you look at rapid rehousing and eviction prevention, the racial distribution of those groups is very distinct to the racial distribution of permanent supportive housing. And I think that we're going to, when we put racial equity as a important factor, we maybe are inadvertently skewing those numbers in a way that maybe we don't like.
Zoe's really liking what you said, Jim.
Yes. Because I see the data, yes.
Did I hear, Nicole, that you said you are going to bring some of this to the HIS, you're gonna try to bring some of this to the HISA meeting and engage some of those providers and some of this? like high level conversation about considerations?
Yes, we have a standing 5-minute update for the Department of History, so I'll connect with our with staff that coordinate Kasson and make sure that we can see if we can extend it. If not, what I can do is get these materials out in advance to folks and request that they email if they can't do. But we're gonna try to sneak it in. The HISN meeting is March 5th, so this is very timely. Does everyone know what HISN stands for?
Housing and Support-
Housing
oh,
and
sorry.
Support Services
You're not-
Network. Oh, sorry.
What is
That was
it?
the quiz.
You gotta-
I'm on my A.
Was that helpful for those that didn't know? All right, folks, I feel like this has been incredibly helpful. Thank you. First, let me just say that. I know these are hard conversations. It's a bit nebulous. It can be confusing and all of our brains go in a little bit different ways, but all of the feedback as just mentioned is been helpful. And to Kim's earlier point, the feedback you've been providing along the way influence how these factors and considerations were drafted in the first place. So I hope you see that as well and just appreciate the adds of leaning more on racial equity and ensuring that we're uplifting the experience and the needs of those we serve. So those are my main takeaways from this conversation, as well as looking more into the needs data and inflow and outflow data. I want to pause, see if there's anything else. We have 3 more agenda items. I want to talk a little bit about the work planning for next year, introduce that. We have Carly from our government relations team, who I will invite to join us and give a state legislative session update, and then we have other staff updates. So want to pause, see if there's anything else on the budget conversation. If not, we'll dive right into work planning.
Can I ask just a general question, in terms of getting the perspectives of the direct care staff, like, is it your all's hope that we're taking back conversations that we're having here and having that with our direct care staff and then bringing it to these conversations rather than you all having those conversations with our direct care staff? So
I would say Drew, both and. I think it's always helpful for folks to bring back feedback from staff, and I'll uplift some of our lived experience advisory committee members in our last meeting, polled their entire teams and brought that feedback in, which was really exciting. And we welcome you to do that. Our folks that are part of the executive director roundtable, that's helpful as well. I don't think it's beyond our role to have direct communication with the folks on the ground.
Like the point about the data being inaccurate. I've asked my managers, because we just received the scorecards, give me a narrative so I can send it to Jess and go, this is what we're seeing. These are the inaccuracies. Because I don't think it's just a system glitch. There's actual problems that have been going on for years. And I really want to make sure that we're not being, we're not being.
Scorecards aren't balanced, but anyway.
Certainly outreach, we've had the same issue for multiple, yeah. And so, because I want to make sure that if that is a factor, is data, they're pulling PHC's data and going, well, where does PHC land in HCMS? And are they one that's gonna get a cut? I wanna make sure that SHS staff have a full understanding of where the inaccuracies are and what we're seeing on the ground, because the data isn't true. So the answer is yes, I take back the conversations to staff and go, hey, this is what's being considered. Where should we be advocating and getting more information so that everyone's kind of on the same page?
and I think it would be really important to be having those conversations directly with staff. There are so many times that little things come up and I'm like, this would be a really great conversation to have had in a county-led office hours. That is no longer a thing. And so I really think that is, not having that keeps getting brought up in my brain over and over about, that's just a missed opportunity of conversation that can be had there. And so.
One thing that we've learned I don't think that, I don't know who's involved with it in this group, but we did cross-sector case conferencing between healthcare and homeless service providers for folks who aren't getting their healthcare needs met before they go to shelter or along the homelessness continuum. And one thing we've learned is that the acuity of people living along the homeless continuum is much, much higher than it previously had been. And I'm not saying anything you all don't know. But one thing I don't know is, do we have a way at this point to measure the acuity and where the most acute folks are? Because that might be a factor too, that if they're ending up in a certain part of the system, maybe that's the part that needs more resources. And I don't know if there's a way current with I haven't seen acuity data along the continuum, and maybe I just haven't seen it, or maybe, I don't know, does that exist?
There's proxies to
Okay.
vulnerability index in coordinated entry system, but it's not the same, it doesn't get at the same information of what acuity means to the healthcare
Sure,
system.
yeah, and again, I speak a different
Yeah.
language, so I'm here as mostly a learner, but also I
Yeah.
think there's a lot we can learn from each other too, and how the system can work together because we're all serving the same people. But it's how do we do it in a way that's like working in tandem too, and like giving the right resources where they need to be, regardless of which system it is.
I was gonna clarify, you're aware of those acuity needs when a participant has been matched to a program and navigation turns out to be a little complex, and then those participants are staff on to one of the case conference. But at entry, we protect that type of data at the beginning of the system.
Thank you, Zoe. All right, sure. If it pleases you, I'll move on to the the work plan introduction. For our 4 new members, this is maybe a new concept. You might be aware of it through your engagement with Metro or the county elsewhere. For other work group, for our original cohort, you'll remember this conversation from last year. We are now in the process of developing our program year 5 work plan for SHS. So as alongside of our budget, we have some clear goals and metrics that are informed by investments, but we also have goals and metrics that are informed by where we want to dedicate our staff time and efforts. So want to just introduce this conversation. It's coming back to you in March, but wanted to give you some time to sit with it. So we'll be drafting our work plan with both internal and external goals this time. We want to talk to you first about external goals, but want to uplift if there's goals that we move forward, that you bring forward. It's not, and they don't end up in the work plan. It might be that we turn them into an internal goal, thinking maybe we can't quite meet this, but we should work on it. So want to uplift that's a little different than what we did last year. And also want to share the timeline. So we're drafting the goals now based on our guiding principles in the budget process and our budget figures, so that we know how many placements there will be because we've set a budget number and that limits our ability to house folks. But there are other goals to consider that are not budget driven. For example, this year we had host a listening session as a goal. So we could do things like that with our staff resources and time. We want your feedback on that. So we'll bring that back on March 20th. We have to submit a draft to Metro on March 1st. And then we're aiming to finalize that before the new year, though we do have some grace. It depends on when our budget is approved. So on the next slide, we have separate guiding principles for these. They're influenced by the guiding principles of the work plan, but a little bit more specific to non-budget goals. So first, we're in a moment of system constraints. That includes the Homeless Services Division, our staff and our provider staff, and our resources overall. So recognizing that constraint, we want to focus on system refinement and limit new commitments or ideas. For those of you that are new to the space, I want to uplift what I shared at the last meeting. The Homeless Services Division is reducing our staff by 10%. We're reducing by 5 positions. So that's more than 10%. It's a fairly large reduction. We're not going to have as much staff capacity as we did previously. Again, we wanted a goal around racial equity. This is the same language from our budget goal, ensuring our commitment to address the inequities in housing outcomes. We also know that what's happening at the federal level is really challenging for our work and for social systems writ large. So we need to make our goals understanding that adaptation is going to be a part of our life next year. And then, of course, our system relies on the many other public systems. We want to collaborate with those systems, particularly healthcare, to improve our outcomes for those that we are collectively serving, that central part of the Venn diagram that comes together. So those are the guiding principles we have forward. Just to again uplift next steps, we'll talk more about this later. But we'll be bringing back a draft to you all in March for this conversation, for the staff in drafting our work plan. Don't have a discussion question today, but do want to leave it open if there's any feedback or thoughts on next year's work plan.
What does program buckets mean?
That's the, if you go to slide 7, Nadia, that's the overall program categories. I've called them buckets for the sake of my own brain.
Thank you.
Yeah, the colorful slide, there you go.
It's probably some PTSD. Bucket conversation.
Yeah, you're right.
Yeah.
I'm sorry, that's not great wording. Not great
I
wording.
apologize. I'm like, yeah, okay.
And do we have Carly in the room or should I message her to join?
She's-
Other Carly.
You're like, she's like, she's not either.
Do we have her in the room?
No.
Great. All right, I will message Carly from Government Relations. She'll join in a moment. So while we wait for her to join, I think we'll pivot to staff updates and start sharing those.
Nicole, can I do mine first? Because I have. a
Yeah,
meeting.
oh, yeah.
If that's okay, great.
Yes.
Didn't mean to.
No,
interrupt you
please
mid-thought.
do.
Hi, everyone, Bianca Valdez, she, they. I'm the Housing Advisory Committee liaison. Nice to see some faces I don't recognize, but, okay, some updates. Let's see here. Speaking of listening sessions, you should have gotten an email about a report. Thanks to everyone who partook in that. That's been kind of a journey of getting all of that information and collecting it. You should have gotten information about it. This summer, we did listening sessions with our community service providers and general public, and they were able to share some successes and challenges with addressing housing insecurity. You can find that on our website. It's under our boards and committees webpage. Now we're just kind of sharing that out to the community that were present there and also community partners. So great job, especially shout out to our data team for making that happen. And communications. We are recruiting for our housing advisory committee. We have 5 slots open, which is a lot. I don't think that's been the case in the past where we've had so many open positions, but people have left midterm, people aren't coming back. And we've been having interviews and we're really excited. There seems to be a lot of great expertise and interest in the room. We have 3 positions: veteran, representative, finance, and urban and regional planning, and then 2 at-large members. So we're excited to have those members start in April. And then we are also having a legislative update at our February meeting with the Housing Advisory Committee. We're going to be discussing some hot topic housing items that are coming up on the docket and what are priorities for the Housing Advisory Committee. What should we be focusing on for some of that work that's happening on a higher level. So those are our updates for this month. Thank you.
Thank you. I think we might have bought enough time for Carly to be on, but she's not on yet. All right, I will keep going with updates and when she joins, we'll just, if you want to flag for me and I'll pause for her. So the first thing I just want to flag, an email will be going out soon or has gone out. We have a groundbreaking celebration. I want to make sure you all are tracking and love to have you there. It's the 4 p.m. on March 3rd that we're celebrating the Hillsborough shelter groundbreaking. It's in quotation because they've already broke ground, but we're doing the celebration when there's less likelihood for snow. And I'm very glad that they decided to do that because it was very cold in February. So want to uplift that. If you have any questions, Nadia has really any staff have the information, but would love to see you there to celebrate this milestone.
Should have been an email that was sent out if you, okay, if someone didn't receive it, just let me know.
All right, I just got a message from Carly. She is coming in now, so I will pause on staff updates and we'll go to the Oregon legislative session update. Are we seeing her in the room?
She's right, just get her promoted to panelist. So she can talk and share. There she goes. And she should be in.
Great. Hi, everyone. Can you hear me?
Yes.
I see heads nodding. Wonderful. Thank you so much for allowing me the opportunity to join you all today. I'm looking forward to this being the first of many as the legislative session commences. And I have to profess, I can't see all the faces of everyone that is on, but I look forward again to just interacting with you all. I guess I'll start at the top. My name is Carly Silva Gabrielson. I am one of the government relations managers here at Washington County, and I am really honored and proud to have housing within my portfolio. I also work on other small transportation issues and land use issues and other things that are not so small, but really that frankly are quite interconnected to housing and homelessness and how we just serve our communities holistically. So again, really happy to be working in this space and with great experts like Nicole and Jess and Molly and others at the helm. I also will say that I apologize that I don't have slides. I will improve on that in the future. I know that once we start to dig into legislation and I start talking about bill numbers and facts and figures and a lot of things, it's hard without those slides. So I aspire to, again, have slides next time, and please raise hands, ask any questions in the chat. I'm always happy to drop bill links directly in the chat for anyone who is interested in digging in a little bit more. But I just wanted to do some initial table setting. I know we have a lot of folks who are really well aware of what's happening in the state legislature, but I wanted to just frame that we are in a long session this year. So it is a 160-day sprint, and it is really focused on the major policy changes and passing the state's biennial budget. Frankly, the passage of the budget is the only constitutional requirement, but as we know, there are a lot of other areas of focus of the legislature and certainly of Governor Kotek. Among them, housing and homelessness is one of the top priorities. We also know that one of the top priorities is going to be budgeting for federal changes and frankly, reacting to those changes as they become a reality and start to impact local jurisdictions. We're also going to see the legislature move forward on substance use disorder treatment and funding. And it is also education budget is the top of mind and concern. As of today, there has been just over 2,900 bills that have been introduced, and we have been forewarned that that number could exceed to 4,000 by the filing deadline. So I think we're in week 5 right now. I hate to admit that I've already lost track, but we're at about week 5, and with about 2,900 bills, it is just immense for the team to comb through. So we're going through all the bills. All of our experts in the department are taking a look at things, and really we're honing in on the positions that the county needs to take either in supporting legislation, opposing legislation, and also just ensuring that lawmakers understand the localized impact to the laws that are passed in Salem. So top priority for us. And as everyone knows, there are supermajorities in the House and Senate for Democrats. So that does mean that Democrats can move forward without any Republican votes, but cannot afford to lose any votes, Democratic votes on bills that require the 3/5 majority. I also wanted to call out that, pertaining to our work, there are 2 committees in the legislature that we like to keep our eye on: the House Committee on Housing and Homelessness, and then the Senate Committee on Housing and Development. On the House Committee on Housing and Homelessness, we do have 2 members that are within the Washington County delegation. So I always like to call that out so we know who our folks are, who we can really focus on. And I do want to just put a plug that your advocacy efforts are really valuable. So I want to be a catalyst for you being involved in Salem. If there's things that come up that you want to testify on, you can reach out to Nicole, myself, and we really can make that happen. But just wanted to amplify that Representative Nathan Sosa is on the House Committee on Housing and Homelessness, and then also Representative Darcy Edwards, who is a newer member. She represents the Banks area, so kind of the western part of Washington County. Let's see, I'll dig in a little bit more, but I wanted to just kind of frame that there are so many bills that really are focusing both on homelessness, but really on homelessness prevention and ensuring that we're meeting some of the most vulnerable members of our communities before they really are reaching those points of crisis. So we're seeing a lot of legislation that is focused on expanding protections for tenants and resources that are available. So that's really wonderful, in addition to some of the more comprehensive things that we're going to be seeing. And I'll just flag, I'm hearing that there is a leaf blower in the back somewhere. So if that gets louder throughout my presentation, I apologize. I will try to amplify. I wanted to talk for a little while about the focus surrounding the statewide shelter program, which is truly wonderful. I do have a bill number for you all. It is House Bill 3644. And what this is that it is the governor's bill to establish a statewide shelter program to essentially transition the state from an emergency response to an ongoing and outcomes-based shelter and rehousing program, which, you know, will continue to support people experiencing homelessness and moving through shelter into permanent housing. It is, you know, a very, very, I would say, forward-thinking and bold focus as the time demands. So this is definitely something to keep an eye on, and to really kind of, I would say, help maintain positive pressure surrounding. You know, I just wanted to highlight that Governor Kotek's emergency response to the unsheltered homelessness has led the state to significantly expand its role in Oregon, as we know, over the past 5 years. And the effort has really helped to maintain funding for local governments and service providers, which have resulted in housing and stabilizing housing for thousands of Oregonians. But as we know, these have been really one-time and emergency investments in nature. So really what this focus is Governor Kotek realizing that that we need to have more of a comprehensive system throughout the state that is not just these emergency focuses. So she called upon Representative Pam Marsh in the House to co-convene a shelter work group that was tasked with over the summer of developing recommendations for, again, a permanent state shelter program. That work began in July of 2024, and I just have to give a special shout out to our very own Jess Larson, our Assistant Director of Homeless Services, the Homeless Services Division at Washington County. She served on that work group and has really helped bring the bill to a space that I think we can really be proud of and continue to get to a place of really being able to champion and support. So the bill essentially requires the Housing and Community Services Department to, again, establish a statewide shelter program and develop regional coordinators who will be selected to administer funding for shelter providers. The Housing and Community Services Department is going to divide the state into regions, which can be no smaller than a single county, through which the program will then be administered. So there's a lot of great stuff within the bill text. I definitely will drop this one in the chat because I know it's of significant interest, so you can find that there. And I'll also just flag that there is a public hearing scheduled on the 24th of this month in the House Committee on Housing and Homelessness. And as you're probably all aware, you can watch remotely, so you're able to join that live or then find that video after the fact. And I have some stats on what the past effort from Governor Kotek's emergency response has been that was contained in the bill text. I'll just add those to the chat because I know that you're all very well aware of that. Something else I really wanted to amplify and uplift is efforts surrounding preservation of affordable housing units that have been federally regulated. Many of you probably recall several years ago, we had an unfortunate dynamic here in Washington County in which an apartment building called Wood Springs was facing expiration of protected federal affordable housing regulations on units. And the county did a lot of work along with local jurisdictions in the state to ensure that those residents were protected. But it was really, I can almost call it a canary in a coal mine because it really was the state's first awareness of this issue because the federal funding that was a program created by HUD was a 30-year program. So those units began to expire nationwide and local jurisdictions and lawmakers realized there was a significant issue. So I'm really pleased to share that This is something that lawmakers are taking incredibly seriously, and there is a package of legislation that is scheduled for hearings on March 3rd, but several bills that I want to call out. Senate Bill 973, it's what we can kind of call the main tenant protection bill within that housing preservation. And that is really just going to be implementing, again, the notices, the protections surrounding tenants who are going to be facing the expiration of those units. There are two other bills, Senate Bill 31 and Senate Bill 32, that were previously serving as placeholders that are also going to be focusing on preservation. One I know is going to be turning into a bonding bill that is going to be contained with the Oregon Housing and Community Services, and it's essentially going to be a tenant mitigation fund. So I believe the ask is going to be about $20 million, and that's going to be supporting residents who are facing the expiration of their units. And there's also, I'm really excited to share that there are conversations that are happening about developing a statewide preservation program that will be housed with the Oregon Housing and Community Service to provide ongoing funding, because again, we know that this is not a one-time issue, and this is also a mechanism that that we can invest in and ensure that some of our most vulnerable community members are protected before they're facing homelessness. So we're going to definitely be championing those bills and excited about that. Something else I did want to just call out in the area of youth homelessness, it's Senate Bill 814. It's one that would modify eligibility criteria for the long-term rental assistance program for certain individuals under the age of 25. So again, focusing on ensuring that at-risk youth don't experience homelessness. Really proud to say, and many of you probably know this, that Washington County is one of 2 pilot regions for the program, the Rental Assistance for Youth program. And this bill is one that the governor's office put forward at the request of the Oregon Youth Authority. And some of the changes that would make to the program is that it expands eligibility to youth that are at risk of homelessness, youth who are residing in child care centers and in correctional facilities, and a few other technical changes to expand that program. Let's see. I also want to call out just really quickly, I know we're maybe getting to time, and I want to pause for questions and also allow Nicole and our other subject matter experts to maybe jump in with anything. But Senator Patterson and Representative Pam Marsh are moving forward with a senior housing initiative, which is going to be HB 3589. And that is going to be developing a senior housing development initiative that is specifically focused on incentivizing housing for older adults and persons with disabilities. So again, another mechanism to ensure that that older adults don't experience homelessness. And quickly on the flip side, I did want to flag that there are efforts to on the Republican side of the aisle to repeal some of our ability to provide services. There is a bill, Senate Bill 645, that does not have legs, but it is a bill to flat out repeal time, place, and manner. So there is conversations in the legislature surrounding these dynamics and how to really respond to the needs of folks on the streets and those who have to respond to them as well. So let's see, I think I'll pause there because again, I know I've been talking for quite a while. Nicole, anyone else in the room, anything to add?
I might just add one piece. Many of you know my former life was in the legislature. This work moves incredibly quickly. It is the type of thing where a bill is introduced one day, it could move through a chamber within the next week. It can happen really quickly, and sometimes it happens very slowly, and sometimes it happens really slowly and then really quickly all at once. So we're gonna see that a number of times with session, and I'm really grateful to Carly for being willing to come and give us all these updates. I'll uplift that there might be an opportunity for us to have the Solutions Council draft a letter in support of something. One thing I think that would make a lot of sense is Oregon Housing and Community Services budget bill. So I'm not aware of a date yet. Carly, this might be news to you. I have just some insider intel that it could be March 17th for the budget bill, which means the testimony will be after. So if that's the case, our March 20th meeting would be too late for us to draft testimony. So I'm actually wondering, Chair, if you would like the Solutions Council to kind of delegate your executive committee to be letter drafters if it has to have a fast turnaround. And I'm curious from the committee if, you know, if there's a level of comfort with that for it coming from the chair and vice chair. And what a process might be to allow the Solutions Council to have a voice down in Salem.
Yes.
Yes.
Yes. Yeah. So I think we're comfortable with it if the entire council is comfortable as well. And we would just keep you informed as we learned more and get you draft copies for your feedback in a very timely manner. So maybe just looking for a thumbs up or anybody, okay, awesome. Anybody, okay, fantastic, so yes.
Great, wonderful, well then I'll Kim and Drew, as opportunities come up and working with Carly, we'll reach out directly to you all. Carly and I can offer some support in drafting, and of course would love your help and thoughts there. And I'll also plug, Carly mentioned, I forgot the bill number, I might need you to repeat it, but Representative Representative Pam Marsh and Senator Patterson, their senior housing bill, they're looking for logos right now for their one pager. So that's a kind of an immediate opportunity, not necessarily for the Solutions Council, but for organizations that are at this table that would like to support. Carly, can you remind me of that bill number? I'm so sorry.
Absolutely. Yes, 3589, and I'll drop that in the chat now. Great. Thank you so much, everyone. Really appreciate all you do and look forward to continuing the conversation.
Thank you, Carly. We have a few more staff updates I'll run through quickly. The first of which being the Metro measure. When we met last, it felt certain that it was going to happen in May. It is now certain that it is not happening in May. So as folks might recall, the Metro Council has been considering reforms to the Supportive Housing Services program to increase regionalization and expand use and increase oversight in the role of Metro. Those conversations are ongoing, but it is now looking at maybe November, maybe not. The impacts of the federal changes, we appreciate Metro for being thoughtful in how they engage in this conversation, knowing all of the unknowns with our current federal administration. So the update right now is that there is a group convened to discuss a potential November measure. And for those of you that are in the room and heard our chair pontificating about the likelihood, it could be pushed back. So we'll keep this as a standing staff update item and keep you all in the loop. If you're hearing things, if you have questions, you're always welcome to reach out at any time. But it's looking right now that group will continue to meet. It might happen in November, it might not. We'll keep you all informed. But what is clear is Metro has a firm understanding of the SHS realities and budget realities. They understand that we are all facing programmatic constraints. They've been working in partnership with the counties to bring forward a request of the Tri-County Planning Body that controls the regional investment funds that sit in our bank account but cannot be used without that committee's permission. Metro and the three counties are coming together as 4 jurisdictions to ask us to use that RIF reserve or carryover fund for our transition fund that we've discussed. So Metro is signed on with this effort. All of the counties are aligned. Our Tri-County Planning Body co-chairs are supportive of this conversation, have had productive conversations, and we are making that ask officially of the Tri-County Planning Body during their March meeting. So that is right around the corner. My early conversations with Tri-County Planning Body members indicate that they'll be supportive of that ask, and Zoe is a member of that committee, so certainly we can imagine we'll have at least one supportive vote here from Washington County. So more on that to come. The other kind of Metro news here, Nadia sent out with your packet a kind of joint statement from Washington County and Metro. There was reporting in the Willamette Week that didn't accurately depict what the current status of SHS carryover for Washington County. I want to clarify that Metro and Washington County were in alignment before that story came out. And because of that story, felt it necessary to put out a joint statement together. We fully understand where our reserves are committed to, allocated and assigned. It's not just Washington County versus Metro County. I want this group to hear really clearly that we're together on this and we're fully aligned. All right, also what was in your packet was the SHS Q2 report. Want to flag that for you. We haven't had a practice of presenting that here. It goes to a body that Jim serves on for us, the SHS Oversight Committee for Metro. We'll share if there's ever interest in us bringing forward these quarterly reports, you're happy to, but we'll start sending them along with the packets when they're ready, so you have them as well. And if there are questions or feedback, you're always welcome to reach out outside of this meeting space or work with your executive committee to bring it to this meeting space.
You guys presented that to the Board of County Commissioners.
Yes,
So
yes.
We could also just send the link.
That's a good, great point. Yes, we will send out that link as well. We presented Tuesday, this material to the board. And the one more piece of staff updates, the federal unknowns and federal action, and to Rachel's earlier question, we are concerned about continuum of care funding and particularly concerned about the resources that this team right over here uses. Our rental assistance team has thousands of vouchers that are funded with federal dollars, and to be very candid, we're concerned. We're having conversations with our federal delegation in partnership with government relations, and we're starting to scenario plan what would be the sequencing should those funds not come through. The hope is that the scenario planning is for nothing. We'd love for nothing to happen and for our federal resources to continue to flow in to the state. We don't know. A number of us are having conversations with our national membership organizations, with other jurisdictions, hearing what they're hearing. But from what I've heard, the continuum of care program is at risk. The entire program, as well as additional necessary programs that support infrastructure and other things. The community development block grant is something we've heard is at risk. We've heard emergency solutions grant, which this committee has talked about, is also at risk. So what I would encourage you all to do now is to continue, if you're engaged in federal advocacy, to continue that federal advocacy. We're very lucky. The Washington County federal delegation is fully behind us. They understand the importance of this program. And if you are part of membership organizations that have members in particularly states with red members, it's important for all of us to be doing outreach to other states and encouraging them to be doing outreach to their federal delegation. Our federal delegation is behind us, and we know that representatives, regardless of what party they're from, care about their communities and care about housing, and they need to hear from their housers. So if you have connections in those states, I'd encourage you to reach out to them, see if you can provide support in them getting information to their delegation. Happy to support with that if it's helpful, and more to come. This will be another standing agenda item. Additionally, some folks noticed us on the way in, shelters are no longer considered safe spaces for immigration enforcement services. So it's not the norm. That is very different than what we've operated from. I would encourage any shelter operators or folks that operate public facing facilities to look at the guidance from the National Homelessness Law Center, which is really incredibly comprehensive. You'll notice we have some new restricted access signs throughout our building in alignment with that guidance. Would encourage you all to look at that guidance for your own organizations. And I've got to make my quick caveat here. The county is not providing legal guidance by sharing this, but it is helpful as we're all navigating a lot of unknowns. And I'm just gonna.
It has been circulated. And does anyone not have it and need it?
All right, and I'm just gonna try to end on a happy note and say, wow, look at the beautiful Hillsborough shelter that regardless of what the feds do, we're able to build and fund and operate. So really exciting to see that progress, and we'll turn things over to Nadia in the chair in case there's any other updates.
No, I mean, this will, personally, this will be my last meeting for a couple months, and then I'll see you all again, hopefully, in I guess probably May. I did want to mention quickly, because I don't think we got to talk about this, that we had a really good lived experience subcommittee meeting. Chelsea was one of our facilitators. We talked about permanent supportive housing and transitional housing. I don't know if you want to say anything or if Hannah is still there, if she wants to say anything, but everyone was really engaged and it was just really great to see. There were some new faces, there were folks that have been coming for a while, and they had a lot of feedback in terms of design and planning for these kinds of services.
Yeah, what was exciting to me was that we were able to get their input on programming design and the actual physical building design as we're building out from scratch the transitional housing program. And there's on the housing authority side, a lot of new PSH sites coming online. So it's a great time to gather that feedback and we can actually integrate it as we're creating it. So that's what I was excited about.
Yeah, I think it was super amazing to have so many people who understand and have passion to give feedback and, you know, have an understanding of operations in a different way, like just what works better rather than like the logistical side of operations. And so, yeah, I think it was super amazing to hear so many different feedback and idea and things that have worked and things that have actually hindered people. And yeah, I loved it. And I was really glad so many people were there.
Well, I can say I have a couple staff members on that subcommittee and they feel completely validated and heard and have loved the experience. So thank you for sharing that, Hannah, and staff for making that happen. It's not recorded. Is that public though? Like if people.
It is not recorded, mostly because we're concerned with the privacy of the participants. But we do take notes and things like that. You know, if there are questions, we can definitely answer that.
Awesome. Anything else for the good of the order online or in the room?
Have a good day.
Did you say have a good day? I think so.
Yeah.
Thank you, Hannah. Sorry.
I was like, okay. It's like, nobody hear me.
What? Okay, bye guys. Thank you.
Bye.
Meeting adjourned.
Good one. Thanks.